Hi, I'm David Baruch, and this is the Anatomy Physical Therapy 1 through 5 stretch video. Today I'm going to show you my 1 through 5 stretch system. It starts at the ankle and ends at the hip and only takes 5 minutes to do. It should be used before activity to reduce the risk of injury and after activity to return muscles to their natural length and tone. It can also be used to directly treat pain syndromes of the lower extremities. Things like plantar fasciitis, patellofemoral syndrome, spin hip syndrome. Try it yourself, see if they work. If you can't get a result, come and see me and we'll see what we can do. Let's get started. Today we're very fortunate to have celebrity trainer from here in South Beach, Michelle Moore, to demonstrate the stretches for us. So let's get started with stretch number 1. Okay, stretch number 1, she's putting her foot on a door frame. You can use a window, you can use a curbside, you can use a tree. But what she's doing here is she's creating a 45-degree angle under her foot, and then she's trying to push her hip into the wall. If she can get her hip to the wall, that means her calf length is excellent. And you can see that her calf length is excellent because her foot is still in that angle and her hip is on the wall. Here you lean back into it, you're not putting your chest on the wall, you're putting the hip on the wall and you're rising up on the back foot. This stretch is excellent for treating conditions like plantar fasciitis, Achilles tendonitis, tib post tendonitis. It will actually fix some conditions of the lower extremity, something below the knee and into the ankle. As with all the stretches, we hold these for 30 seconds. Okay, come out of that for us. The next stretch is stretch number 2, which is the hamstring stretch. For the hamstring stretch, again, we put our hands on the wall, but this time we set up like we're going to do a calf stretch, a traditional old school calf stretch, and then we lock the front knee and reach for the toes. Very nice. And as you can see, she's quite flexible. She can touch her toes. If you can't touch your toes, you know that you have work to do in the hamstring area. Again, she's holding it for 30 seconds and she's going to switch and do both sides. Okay, let's come out of that one. Let's do stretch number 3. Stretch number 3 is a little more challenging. This one I also call the Kung Fu stretch. This one we're lunging to one side, so we're going to pick a side. Here you can see Michelle, I think, is going to lunge towards the left, yes. And she's going to try to stay up as straight as she can, and she's trying to get her groin towards her left heel, which she's doing very nicely. And then she's reaching towards the outside of her ankle. And she feels that. So she's feeling that on the inside of her groin, into ADMAG and the long adductors, the muscles on the inside of the groin. And this is going to save you from conditions like pes anserinus bursitis and other groin type conditions. Try this one if you have pain before you run off to the orthopedist or the physical therapist and see if you can treat yourself. Okay, great. And as before, she's going to do the other side, and both stretches are held for 30 seconds. Next one is stretch number 4. This is a traditional quad stretch. Stretch number 4 and quad means 4, so it's easy to remember. For this one, she's going to make sure that her knee is behind the other knee. She's going to try to put her heel towards her bottom, but she's still going to try to stay up straight. If you bend forward, you're cheating. If we can keep the knee behind the other knee, then we also get rectus femoris, which is on the front of the thigh, and that's usually the most problematic of the muscles in the quadriceps, or the heads in the quadriceps. Very nice. Great. Last stretch is stretch number 5. Stretch number 5 is a lunging stretch, and it's going to do the front of the hip. So we're going to do the left hip here. Very nice. She's going to lunge forward, and she's going to try to rotate her pelvis so her left hip comes forward, and as you can see, she's turning towards her right to really open up the right hand side. And she's lunging forward. She's going to try to make sure that she doesn't put her knee too far over her toes. If she is, that means she's very flexible. She can step forward just a little bit and then go again, and her knee shouldn't go over her toes, and she'll still get a nice deep stretch in the front of her left hip. Of course, we're holding these for 30 seconds. Out of that, and she will do the other side as well. So these stretches progress from calf to hip in a logical progression. By doing calf, hamstring, groin, quad, and hip, you've done the whole lower extremity, and you've taken care of yourself for before activity to make yourself more flexible, and then you do it again after activity to make sure you stay flexible until you exercise again. This is the lower extremity 5 stretch system. We also have an upper extremity 5 stretch system, which we're going to show you soon. Okay, so the stretches you just saw look easy enough. Michelle made them look pretty easy because she's quite limber. Give them a try yourself. Get deep into the positions, pause the video if you like to make sure you're in the right spot, and hold those stretches for 30 seconds. 30 seconds is a long time, so watch a clock, make sure you're deep into the position and hold. No bouncing, just hold. These stretches are going to help you to avoid injury and keep you pain-free so you can do all the exercises you love to do. Thank you for watching my video.